in last video, we saw the topic crystalloid fluid. Crystalloid fluids. Today we'll see colloids. In case of colloid, there are of two types. First is your synthetic colloid. First is synthetic and the second one is natural. First we'll see the synthetic colloids and what are the properties of colloid, in which conditions these colloids are used and why they are used. So if we look at the property of colloid, they are high molecular weight substances. They remain within the intravascular compartment because of their large size, and they increase colloid osmotic pressure. Because of this, they pull, or we can say they hold water with them. So if we are using a colloid molecule, because of the osmotic pressure, it attracts the water molecule, or in other words, it holds the water molecules within the intravascular compartment only. So in this case, if there is a case of hypovolemia, means the volume in the vascular compartment is less and the patient is unable to bear crystalloid load. It means, see, in case of crystalloid therapy, 2/3 of the given drug will go out. Only 1/3 will remain inside the vascular compartment. So we use large volume of crystalloid fluid so that they will remain inside the vascular compartment. Those patients which could not bear this load, this large volume load, then in that case we can give colloids so that the volume of the crystalloid can be reduced by 40 to 60%. If we add our colloid molecules along with the crystalloid, the advantage is that we can reduce the dose of the crystalloid. So along with the crystalloid, we can use molecules colloid just to reduce the dose of the crystalloid for those patients who does not bear this load. And for those patients, and the second disadvantage of crystalloid therapy is, if we give, for example, these are the plasma protein, and if you are giving a crystalloid in large dose, that may cause decrease in colloid osmotic pressure because it causes the dilution of the plasma. Plasma gets diluted if we use the large volume of crystalloid, and that will decrease the colloid osmotic pressure. So to increase this colloid osmotic pressure, we can use our colloid. That may be synthetic or that may be your natural one. First we'll do the synthetic one. Out of synthetic colloid, there are 4 categories. First is dextran molecule. Second is gelatin. Third is HbOC, hemoglobin-based oxygen carrier, and the fourth is hydroxyethyl starch. Out of these 4, hydroxyethyl starch is most commonly used nowadays. Dextran are nothing but polymer of glucose. They are polymer of glucose. These are not used nowadays. Gelatin in case of bovine origin collagen, if we hydrolyze this collagen, then gelatin is obtained. So from the bovine collagen, after processing, this molecule is obtained, that is gelatin. But the problem with this gelatin is hypersensitivity reaction. Second problem with this gelatin is the short half-life, short duration of action. So this gelatin is also not used. HBOC, the example of HBOC is oxyglobin. Oxyglobin. This oxyglobin molecule, it is also of bovine origin. This molecule is also of bovine origin. In this molecule, oxyglobin, it is nothing but your hemoglobin which is carrying oxygen. How much oxygen it carries? 30 milligram, 13 milligram per deciliter. This is the MCQ. That hemoglobin based oxygen carrier is oxyglobin, which carries 13 milligram per dl, and this is of bovine origin. The problem with HPOC is short half life. Short half life. The next molecule, which is commonly used in synthetic colloid in veterinary practice, is your hydroxyethyl starch. HES, that is hydroxyethyl starch. This is more commonly used. This is more commonly used. This hydroxyethyl starch is nothing but a derivative of amylopectin. Amylopectin. And this amylopectin is nothing but a branch chain of glucose. This is branch chain of glucose. So in case of this glucose molecule, there are carbon atoms, and carbon atom contain OH group, multiple OH group. These OH group are replaced by hydroxyethyl. Hydroxyethyl. So the starch molecule, amylopectin molecule, in which OH group is replaced by the hydroxyethyl, is called as hydroxyethyl starch. Why these are replaced? Because after replacing the OH group and substituting hydroxyethyl molecule, it becomes long acting. Now the elimination or degradation of this molecule will be slowed down. So hydroxyethyl starch, they are the derivative of amylopectin, which is nothing but a branch chain glucose molecule in which OH group are replaced by the hydroxyethyl. So the name is hydroxyethyl starch. These hydroxyethyl starch, these are of three types. More commonly used hydroxyethyl starch in wet practice, they are hetastarch, starch, pentastarch, and tetra starch. This was the MCQ asked in ICAR NET 2021. Which of the following options were A, B, C, and D? D was hexastarch. Question was, which of the following hydroxyethyl starch is not used in veterinary practice? Answer is hexastarch. So these three are commonly used: hetastarch, penta, or tetra. These molecules differ by their molecular weight. So when to use this HES molecule? When there is hypovolemia. When there is the hypovolemia. So the first component of fluid therapy was resuscitation. that is life-saving dose. So resuscitation dose or shock, hypovolemic shock in case of dog for the HES is 5 to 20 ml per kg, and in case of cat it is 2.5 to 20 ml per kg. The problem with cat or dog is mainly with the cat is slow administration is required. Slow administration over 1 5 at least 15 minutes. Reason, because if rapid administration is given, then it may cause vomition in case of cat, mainly cat. So these HES molecules, they are given slowly over 15 minutes. If you administer them rapidly, then vomiting will be there in case of cats. So these synthetic colloid, which were of four types, dextran, gelatin, and HBOC, and last is your HES. Out of these four, this is the most commonly used. These are of three types. The commonly used are hetastarch, penta, and the tetra. What is their use? Their use is to giving minimum fluid volume to restore the intravascular fluid. That is, there is a shock condition, hypovolemia. If you use the crystalloid, then large volume is needed, because in that case only 25% will remain, other 75 moves to the interstitial. So if we give this molecule, so less volume is needed and it will remain within the intravascular compartment. And the second, one more condition where we use is serum albumin. Albumin is the mainly colloid osmotic pressure determining protein. If albumin is less than 1.5 gram per dl, then also we go for the hydroxyethyl starches. So these are the colloid molecule. So the problem with colloid molecule is some kind of hypersensitivity or allergic reaction. So after synthetic colloids, we will move towards the natural colloids. Natural colloids. They are your blood and blood products. So when to use these things? The first condition is when the blood loss is more than 25%. Suppose there is one road traffic accident and the canine or cat losing blood. If the blood loss is more than 25%, and second is if the PCV is less than or equal to 20%. So these are the indications to go for the blood transfusion. So before starting blood transfusion, we'll see the types of products which are available and where they are used. The first is the whole blood itself. The first is the whole blood itself. Whole blood means this is the blood that we collect directly from the donor. So if we start with the first, that is the whole blood. This whole blood we directly collect from the animal. This may be fresh or this may be stored. When it is called fresh whole blood, if it is stored at room temperature for less than 24 hours, that is your fresh whole blood. Second condition, if it is refrigerated for 48 hours, this is called fresh whole blood. Second is your stored whole blood. When it is called stored, when it is refrigerated more than 48 hours, it is called stored. Or if it is stored in CPDA 1, that is anticoagulant, up to 3 weeks. So these are the two terminology with the whole blood. Fresh means less than 24 hours, or if it is refrigerated then 48 hours. Stored means more than 48 hours refrigerated, or it is stored up to 3 weeks in case of CPTA. The indications for both, whether it is fresh or stored. Road traffic accident that may lead to acute blood loss. Acute blood loss. So this is the indication where we use whole blood. The stored blood contain coagulation factor 2, 7, 9, 10, which are vitamin K dependent. In case of animal, if there is a poisoning of sweet clover poisoning, then vitamin K dependent factors decreases. So in that case, we can give stored blood, which is a good source of clotting factor 2, 7, 9, 10. These are vitamin K dependent clotting factors. Then with this whole blood, there are two MCQ. One dog unit equal to how much volume? It is 450 ml. One cat unit, that is 60 ml. So these are not given in module. So remember the dog unit, 1 unit of blood if you are collecting from the dog, it means 450 ml. 1 unit of blood if you are collecting from cat means 60 ml. So 1 unit dog is 450 and 1 cat unit is your ml. That is collection from the healthy donor, cat or dog. After whole blood, the second is packed RBC. Suppose this is the whole blood. If we centrifuge, then RBC will settle down and what is left above is plasma. So this fraction is called packed RBC. And the indication for this packed RBC is the anemia. The second component after centrifugation will be your plasma. So packed RBC are the RBCs where we use for the anemia in case of dog. And the second component we obtain is the plasma. If we look at this term plasma, there are three terminology: fresh, frozen, plasma. Number one, what is fresh plasma? Fresh plasma means plasma which is transfused less than 8 hours after after collection. That is the fresh plasma. Second is fresh frozen plasma. What is fresh frozen plasma? This is the fresh frozen plasma. It is collected and we have to use is less than 1 year of time. Less than 1 year. And it is stored below 20 degree centigrade. That is maybe minus 18 degree centigrade. But below 20. Third is simply FP, your frozen plasma. Frozen plasma. Frozen plasma means plasma which is of more than 1 year of age. So these are the three terminology where we go for transfusing less than 8 hours fresh plasma or from 8 hours to 1 year. It is fresh frozen plasma. And the frozen is the plasma which is of more than 1 year of age. In these plasma, the problem with the frozen plasma, in case of frozen plasma, there are some clotting factors which are stable. There are some clotting factors which are labile. Stable clotting factor like vitamin K dependent 2, 7, 9, 10. These are available. But clotting factor number 5 and 8. These are absent in the frozen plasma because these are labile along with this von Willebrand factor. So frozen plasma maintain these clotting factor but not these labile one. Next product, first was your whole blood, fresh or stored. Second was your packed RBC. Third was your fresh frozen plasma or frozen plasma. And fourth is your cryo precipitation. Cryo precipitate. This is nothing but a source of clotting factor number 8, 13 and 4 Willebrand factor. And the fifth one, which is I explained already HbOC, that was oxyglobin, because it is related with the oxygen carrying molecule. It is oxygen carrying and it is carrying the hemoglobin 13 mg per dl. So these are the products of the blood and blood products which we use when these are used when the blood loss is more than 25% and PCV is less than 20 or equal to 20%. The next question is how to calculate the volume you want to transfuse into the dog or cat. We take recipient body weight in kg multiplied for dog we multiply 90 or for cat we multiply for 66. This is a constant 90 or 66. No, this is nothing but the blood volume of dog is 90 ml per kg and the blood volume of cat is 60 to 70 ml per kg. So this is the factor multiplied by the desired PCV. The desired PCV in case of dog, in case of cat. This is 25% and this is 20%. Minus patient PCV at the time of transfusion divided by the donor PCV. This is the formula to calculate the volume to be transfused. Where body weight is given, 90 is also given, desired PCV is also given. For dog we want 25%. Patient PCV we know, and from the donor's blood we can calculate PCV of donor. So, before starting the topic of transfusion, first we'll see some basics of blood typing. First we'll start with the dog, and here we'll have cat. In case of dog there are 13 and in case of cat there are 3. If we look at the dog, RBC of dog, on the surface antigen is there. This antigen on the surface of RBC, it is called dog erythrocyte antigen. In case of cat, these 3 are A, B, AB. A is most common, AB is rare in the domestic cat. If we look at the RBC of cat, they also have antigens. The A blood group have A antigen, B blood group is having B, and AB is having AB antigen. So these are the antigens normally present in their surface of the RBC. But the difference between dog, cat and human, the difference is in plasma. In case of dog, no natural alloantibody is present. But in case of cat or in case of human, in their plasma, alloantibodies are present. Naturally, they are present. So natural alloantibodies are present in case of cat. These are not present in case of dog. So the significance of these antibodies is that the A blood group, B and AB. In case of A blood group, the antibodies present are against the B. So these are anti-B. In case of B blood group, antibodies are there in their plasma that are for against the anti-A. No antibodies. In case of dog, These natural antibodies are not present for your DEA 1.1, 1.2, 3, 4, 5. These are not present. Natural antibodies for different types of blood group, they are not present. In case of human being, in case of cat, they have antibodies in their plasma. The significance of these antibodies lies in the blood transfusion. In case of cat, in case of cat, so this is the cat with blood group A, and this is the cat with blood group B. Again, there is one cat with A and one is with blood group B. Cat B has strong antibodies against A, and these are in high titer, high concentration. So if the blood of A group A cat, if we transfuse to the B, then severe fatal transfusion reaction will occur. Transfusion reaction will occur. If we transfer this A cat, they have weak antibody against the B. So if the blood of B is transfused into the cat A, then the reaction will be mild. Mild transfusion reaction will take place. So this is how the B group is having more strong or high titer antibodies against the A. And this is naturally present in the blood of the plasma of the cat. So if we transfuse B to A, then weak antibodies are there and that is a low titer. So mild transfusion reaction will be there. So this is the significance of the allo antibodies. In human being also, if we look at our blood group A, B, AB or O, in case of A blood group, the antibody present will be against B. In B, they are against A. AB, no antibody, and in case of plasma of O, for both A and B. They are naturally present. Similarly, in case of cat, they are naturally present in their plasma. But in case of dog, similarly, if we look at this animal, this is the dog. And in case of cat, this is the cat. So if we transfuse blood of the dog into the cat, if it is a life-saving emergency, if it is a life-saving emergency, we can transfuse blood of the dog into cat because cat do not have natural antibodies against the antigen DEA. In their blood, they have antibodies against A or B, not against the DEA. So the first transfusion will be successful. But this is not indicated normally, only indicated in some emergency situations. If you come to the dog, in case of dog, these are 13. blood group type. In case of market, initially there was some anti-sera or reagent were available. Initially, reagents were available for 1.1, 1.2, 3, 4, 5, 6, 7, 8. But at present, these anti-sera are present only for the sixth blood group. It is not available for number 6 and number 8. So, the commercially available reagent for the typing, they are available for 1.1, 1.2, 3, 4, 5, and 7. Only for these 6. Out of these blood groups, the most antigenic is 1.1. 1.1. So before any transfusion, the donor should be 1.1 negative. So in case of dog, if you look at the plasma, there is no natural antibodies. So if no natural antibodies, if there is some blood group like 1.2, 3, 4, 5, 6, 7, 8 something, and in that case, in the plasma of the animal, there is no antibody. If you transfuse this blood, so for the first time, this transfusion is successful. First transfusion is successful because there are no antibodies, no hemolytic reaction. In case of second transfusion, after the first transfusion, the dog becomes sensitized. It means whatever blood group you transfuse, it develops some antibodies. The immune response is generated. Second time, if the same blood is transfused, then that will be agglutination happen. Agglutinated. Because the animal was already sensitized, immune response was generated, antibodies are formed. Second time, the same antigen will come and there will be antigen-antibody reaction. The agglutination or hemolysis will be there. So in case of dog, first transfusion is successful, but not second. So before second transfusion, what is essential? The essential is cross matching. Essential is the cross. That is very important. So this is essential for the second transfusion, not for the first. But in case of cat, because they have natural antibodies, so the first cross matching is also important. First is also important. Then if we go for the cross matching, it is of two types, major or minor. In case of major cross matching, we will take donor blood and recipient plasma and we check for the agglutination. If there is agglutination, it means the blood group is incompatible. And if there is no agglutination, we can go for transfusion. In case of minor cross matching, we use recipient blood plus donor plasma. And again, we check for the reaction, agglutination. So if there is agglutination, it means there is mismatch, there is incompatibility. So in case of incompatibility, we should not go for the blood transfusion. Then if there is compatibility between the blood of donor and the recipient, then we'll move ahead. Then we go for selecting a donor. How to select a donor dog or a donor cat? There are some criteria based on which we select this. The body weight of the dog should be more than 25 kg and the cat body weight should be more than 5 kg. PCV of donor, it should be more than 40% and this PCV more than 30%. And this dog should be DEA 1.1 negative because this is the most antigenic and may cause the but if we use the term universal donor should be 1.1, 1.2 and 7 negative. That dog is called the universal donor. If it is not available, then at least DEA 1.1 negative should be used. The third thing is the blood from the cat or from the dog, it should be free from hemoprotozoans, hemoprotozoa infection. In case of dog, like Anaplasma, Babesia, Ehrlichia, it should be absent because in case of Ehrlichia, we know there are less platelets. So if we use the blood of the Ehrlichia patient, then already there are thrombocytopenia, then it is not good. In case of cat, hemoprotozoa infection should be absent, like Hemobartonella. So once we selected our donor based on these criteria, we'll go for the collection of blood. First should be the site. Site is your jugular vein. The most preferred site is the jugular vein. 1 unit of dog, that is 450 ml, and 60 ml is the 1 unit of cat. After collection, the anticoagulant which we use is CPDA1, citrate, phosphate, dextrose, and adenosine. This we use, or we can use 3.8% citrate. Or in case of immediate transfusion, we can use heparin also. But this is the preferred CPDA1. This is preferred for cat and dog. This is preferred for cat and dog. The question is, if we are using the CPDA, then for how many days we can preserve this blood? So for CPDA, we can preserve the blood of dog and cat up to 35 days. This is important. 35. So CPDA is the preferred anticoagulant to preserve that blood and for up to 35 days in case of dog and cat. Then we go for the transfusion of the blood. In case of dog, if there are DEA 1.1 positive and this is 1.1 negative, and this dog is your 1.1 positive and this is your 1.1 negative. So the blood from the positive may be transfused into the positive, and blood from the negative may be transferred to positive because the RBC of this blood, they are not carrying any antigen. But this negative, this positive to negative, it should never be transfused because this is the most antigenic in nature. Transfusion reaction will be there. So if we summarize this blood transfusion, then you should know first is the blood volume, 8% of the body weight. Then what is the blood volume in case of dog? 90 ml per kg. In case of cat, it is 60 to 70 ml per kg. Dog can donate up to 20% of their blood volume, and cat can donate up to 10% of their blood volume. And then in case of dog, 13, in case of cat, 3. In the market, only for 6 we have typing reagent. And what are those 6? 1.1, 1.2, 3, 4, 5 and 7. For 6 and 8, not available. And for cat, there are 3 types, and all 3, there are sera or reagent available in the market. For dog, remember there is no natural allo antibody in their plasma. So first transfusion is successful. Second time, sensitization will occur and that may lead to transfusion reaction. But in case of cat, human being, first transfusion will lead to reaction because they have natural allo antibody. Allo means allo means different member of the same species. So they have antibodies against different members of the same species. Then some important point from the fluid therapy. Crystalloid, as I told you, these are of 2 types, replacement and maintenance type. The maintenance type of crystalloid fluid, they have low sodium but high potassium than replacement crystalloid. These replacement have same or similar sodium with the plasma or ECF. But these maintenance, they have low sodium but high potassium than the plasma and also than the replacement fluid. PSC. Okay. So I explained three components of the fluid therapy. First was resuscitation for the hypovolumic shock, where we can use crystalloid fluid. Along with crystalloid, if you want to reduce their volume, then along with this you can use colloid like HES. If the loss is more than 25%, then you may go for the blood transfusion. Once the intravascular compartment is restored, then we will go for the replacement component. Replacement. In this case, we try to restore the interstitial fluid compartment. That is nothing but it was your dehydration. So first priority is to restore the volume of the intravascular compartment, because that is related with your hypotension, BP, heart rate and all things. That is providing oxygen to the peripheral all tissues, and if you do not maintain this volume, the patient may go under hypotension or because of hypoxia, cell death and the death of the animal. So the first priority is resuscitation, that is shock bolus, shock dose. That you have option, you have crystalloid, but the problem with crystalloid, only 25% will remain inside the compartment, 75% will go out. So 25% is, this minimum is not essential to maintain that volume. So you need to give large fluid, again more volume to maintain that volume. The better option is that you go for the colloid. Colloid, they have the property to increase the osmotic pressure and they hold the water and that volume for at least 18 to 24 hours. If the loss is more than 25%, means both the therapy, crystalloid and colloid, is of no use. These are failed and loss is more than 25%. You go for the blood transfusion. Then after this vascular compartment is maintained, restored, come for the replacement. Check if there is interstitial fluid loss is there or not. If it is dehydrated, then go for the replacement crystalloid. If it is okay, then stop at this point. After replacement, if it is rehydrated, then we can go for the maintenance component of the fluid therapy. In case of maintenance, the patient is healthy, fully hydrated, but it is not drinking, not eating. So we will give only the maintenance fluid, and those fluids are hypotonic. They are hypotonic. These are the normal maintenance for the physiological cellular metabolism, like your 0.45% NaCl or D5. So these were the main three components of the fluid therapy and the blood transfusion. In the blood transfusion, the most important part was the concept of allo antibody, which are present in the cat and the human, and it is absent in the dog. It is also absent in cattle. So the first transfusion is successful, but in case even the first transfusion need cross match, first you check whether there is agglutination or not on the slide. If it is agglutinated, means incompatible. This is mismatch. If it is compatible, then go for the blood transfusion using your CPDA anticoagulant, and the transfusion volume of the blood is 10 to 22 ml per kg, and this 22 is the maximum where we use for the shock. If transfusion reactions happen, then we stop the blood transfusion and we can give dexamethasone or uh, what we call Avil, that is your uh, anti-allergic drug. So our fluid therapy was crystalloid and the colloid, synthetic, and that was your blood. We and crystalloid were replacement and your maintenance. So first we try with crystalloid and synthetic colloid. If this failed, we try for the blood product like plasma, packed RBC, or your whole blood, and sometimes HBOC like this process. So parvo puppies was best example where hypovolemia was there along with the dehydration. So in that of parvo, we need to correct both hypovolemia as well as dehydration. So this ended our fluid therapy and blood transfusion